Good afternoon, ladies and gentlemen. We start today's proceedings of the National Leadership Conclave with a topic which has taken up the entire nation's mind space and is relevant for each one of us. Vaccinating India, immunizing 1.4 billion people in a rush. May I welcome on the virtual stage Dr. Krishna, Chairman and Managing Director, Bharat Biotech International Limited, Dr. Shiv, Sarin, Director, Institute of Liver and Biliary Sciences, and Mr. Sreenivasan, Jain, Managing Editor, NDTV. Dr. Ella, it is a privilege to have you on the AIMA platform, and I think for the first time, but not the last, I hope. And many thanks for agreeing to talk to us on your thoughts for vaccinating India cheaply and quickly. You have led the Indian effort to develop a COVID vaccine, and the Prime Minister has taken a shot of Bharat Biotech's Covaxin in a show of confidence. A molecular biologist by training, you have been a serial entrepreneur and have founded businesses in the areas of veterinary vaccines, food processing, and biotech infrastructure. You have risen to the challenge of COVID, and your partnership with the government's ICMR has been vital in India's bid to contain and eradicate COVID. In this session, we would love to know from you how India can immunize its 1.4 billion people quickly so that the country can get back to business. Many thanks once again for joining us and a warm welcome to you. Dr. Sarin, again, first time with AIMA, thank you so much. It's a pleasure to have you with us, and thank you for agreeing to do this session. An innovative clinician and a distinguished medical professional, your advice has been pivotal in the Delhi government's efforts to increase COVID testing and vaccination and the promotion of COVID-appropriate behavior. A pioneering doctor, you led the hepatitis B vaccination program in India, and you are the founding director of the Institute of Liver and Biliary Sciences. Thank you for joining us, and a warm welcome to you. Mr. Sreenivasan Jain, it's a pleasure. Again, I think it's the third person in a row to have you with us for the first time in AIMA, and many thanks for agreeing to moderate the session. A veteran of TV journalism and one of the more respected news show anchors, you host some of the most watched shows on NDTV, including Reality Check and Truth versus Hype. Thank you for joining us, and a very warm welcome to you. India is witnessing a fresh wave of COVID infections, even as the country is on a vaccination drive. There are constraints on the availability of vaccines because of production and distribution bottlenecks, and also because of competition between countries for cornering the available vaccines. In this session, we will find out how India can ramp up its vaccine output, distribution, and options so that we can get back to normal life and business soon. With these words, I'm pleased to hand over the session to Mr. Sreenivasan Jain. Over to you, Sreenivasan.
Thank you very much indeed, Rekha, and to AIMA for allowing me to be part of this very important session. I won't spend too much time on any further introductions because I know everyone is eager to hear from these two very important voices we have who are absolutely central to this current imbroglio that we find ourselves in, where on one hand, India is seen very much as the vaccine factory of the world, rightly so, because of pioneers like Dr. Ella and others. And on the other hand, we're also facing the worst, one would say, or almost the worst globally of this frightening second wave. So how do we make sense of that? On one hand, we are this vaccine powerhouse, and on the other hand, we seem to be grappling against this second wave. So the format, as I understand it from the organizers, is that we shall have a conversation with these gentlemen for a good 30 odd minutes. And then we will get a chance to get some questions as well from the audience towards the end. So do send in your questions, and we'll try and make it as interactive as possible. And of course, organizers, do alert me when we're running out of time, because television anchors, if they're given a free writ, can keep going on and on, especially when you have such terrific panelists. Okay, on that note, let me just start with you, Dr. Ella, because I think the big question everybody wants to know is, you are one of the two domestic vaccine makers who are at the front line of vaccine production at this time. What are some of the challenges you're facing? Because on one hand, we are trying to ramp up vaccination as the second wave gets worse. The government is talking of Tika Utsavs and so on. They've now broadened the parameters to include everybody above the age of 18 from the 1st of May. But you are getting reported multiple instances of state governments and others saying that we're running short of vaccines. So what are the challenges you're facing at this time as a vaccine manufacturer?
It's really honored to meet you, Sreenivasan Jain. And finally, I think I want to thank Munjal forced me to be there, and I'm really honored to interact. And I think, the two sectors are facing a problem in this country. One is the vaccine manufacturers, and second is hospitals. Both are at the loggerheads of the both. We are facing all the brickbats of the entire system. One wants to make more vaccine, one wants to have more hospital beds, and the other side of it. And it's a very challenging time. One, when you have a disease, some of the employees also can get, their family gets sick. So getting employees moving into the manufacturing facility, everything is a challenging for us. Getting a raw material is a challenging for us. And then I want to say one thing which I've never been told to anybody. The live vaccine and inactivated vaccine, there are two major platforms. The live vaccine is like adenovirus vector-based vaccines, and inactivated vaccine, you kill the vaccine. The productivity of inactivated vaccine is 1 out of 100. If live vaccine can be manufactured 100 doses, inactivated can only make 1 dose.
Right.
So that speaks, the technological platform problems.
And yours is the inactivated.
Ours is inactivated.
Vaccine.
So
yes,
it's comparable. But I think, what we are doing right now is that we had only started with one manufacturing facility in the beginning, thinking when we were doing clinical trial, because we need to have BSL-3 facility. So we had only one BSL at that time. We started that and start doing all the clinical trial and all that. But the second facility got activated. Now two BSL-2 plus production facilities also activated. Now we have 4 production facilities activated in Hyderabad. We are ramping up the production right now. And I think, by July, August, we will be able to reach 700 million doses to 800 million dose production capacity per annum. And I think I just want to tell you, Sreenivasan, that the inactivated vaccine, anybody produced in the world, maximum 150 million doses only. That is Sanofi. Nobody else produced more than 150 million inactivated vaccine anywhere in the world.
150 million doses
is what people produce globally, inactivated vaccine.
Annually, you mean?
Annually. Okay. And we are reaching 700 to 800 million dose capacity. That actually speaks the capability of the Indian company that can ramp up the inactivated vaccine to that extent. So people know 700 million is not a great. The other people can make 1 billion doses. So I don't want to be correlated in that fashion. So I think it's reaching 700 million. And I think the nice thing about this vaccine, it can reach to children's from 2 years and above, but we have not done a clinical trial. Right now, we got the approval of the clinical trial. We'll be starting soon on children's from 2 years to older. So I think, India is in a well position. The only thing is the timing was too short for a population of 1.4 billion.
Right.
But I think, I would say strongly, by next 6 months, we will ramp up a lot of platform technologies, a lot of other platform technologies. So we will not be left over behind.
So if I can just ask you, just to put it in perspective, Dr. Ella, you're saying you'll be able to reach 700 million doses annually by the end of the year. At the moment, what is your current production capacity?
We have right now, last month we produced 15 million doses. This month we're reaching 20 million. Next month we'll reach around 30 million, followed by ramp up by 75 million doses. Because we're adding the Bangalore facility, two new production facilities in Bangalore, which are BSL-3 plus facility that is also getting activated.
Okay, because we were trying to do some math about the gap between vaccine production and consumption, and our numbers are slightly outdated. So please correct me if I've got it wrong or if their numbers are outdated. This is about I would say about 3 weeks old numbers that we found, that Covishield is producing about 21 lakh doses a day. Covaxin was about 1.6 lakh doses a day. That comes to about 23 lakh doses a day. But we were administering at that time, that number must have gone up, 33 lakh doses a day. That was the target being achieved by the government. So there was a shortfall of about 10 lakh doses on a daily basis. So
10 lakhs is a 1 million doses. I think is reachable. 1 million dose reachable by June, July. We'll be able to reach 1 million dose per month, per day, 1 million per day. We'll be able to reach by June, July. We'll be able to reach that.
Oh, okay, wonderful.
See, you look at it, they give 30 million doses order to Government of India. We supplied all the 30 million doses for last 3 months.
Right.
April, they want us to supply 10 million, and we are ready to supply. Already, we supplied 8 million doses. So another 2 million we supply, we are done with the 2 million of this month.
Okay. Just one final question before I move to Dr. Sarin. As far as the whole funding question is concerned, because that's again something which came up, I think Adar Poonawalla also raised it, that there is a question of being able to advance lines of credit to you, make advance payments, because you're trying to ramp up production and because you're producing at this extraordinary time. The government has indicated that they are willing to do some front loading of payments. I believe the figure mentioned was 2,000 crores to SII and 1,000 crores to Bharat Biotech. Have you heard any, I mean, firstly, how important is that advance funding to you? And have you heard anything from the government about it, about receiving it?
Sreenivasan, we never asked even for production and clinical trial and all the anything, you know, so far, we never took any money from the Government of India. Even including our clinical trial, we spent almost 350 crores for phase 2, phase 3 trial. We spent 350 crores, we never took money from the government. So we had we thought it's a moral obligation for us to help the community. You may think it's a philosophical or you say it's political. I'm not interested in that. But I can tell you honestly, as a scientist, it's my moral obligation to help the community. If anything, I can do it. And that's why we never went behind any government for any funding at all for our inactivated vaccine.
No, I appreciate that. I'm just saying that as you ramp up and expand, are you looking for some kind of...
No, money was a secondary. Money was a secondary for us. The problem was getting ready with the facilities, upgrading the facilities to risk analysis to meet the global requirement. Because we can't make a vaccine just like that. We need to have, because in WHO, we are pre-qualified company, 5 vaccines. Yeah. WHO pre-qualified. If anything they come, oh, you've not done this project like this. So that means you're not up to the standard. That will get into trouble for us. So we need to follow certain standards of global standard. And we followed that. We upgraded the 4 facilities. Now it came up the facility. That's why it got delayed. But we are never lack of money. No, I think we have enough funds. And we are, thanks to rotavirus vaccine and typhoid conjugate and rabies, we are doing very well in the project. I think we may be poor people, but not short of good heart.
Rich in other respects. Dr. Sarin, why did you come in here? Because I think the thing that has become a very urgent question at this time is about the manner in which this vaccine rollout has happened. The government has set ambitious targets, but halfway through that, we're seeing the shortage of vaccines. We're seeing some hospitals and vaccination centers having to turn people away. We're also seeing vaccine hesitancy. People are still not buying in. What do you think are the lessons here? Has there been some amount of mismanagement? Has the planning not been sufficient in the manner in which it has been rolled out? Dr. Sarin, I think you might be on mute.
Yes, thank you, Mr. Sreenivasan, and I want to thank Mr. Munjal and AIMA for inviting me for this very important session. Before I answer the vaccine-related issues, I would put in 1 or 2 things for better perspective. The recent surge in the number of those who are getting infected, people need to know this is a new virus in a way. It's a mutant virus which has very badly mutated, and kindly consider this as a new virus. This is posing challenges for diagnosis, posing challenges for us for antibody formation, even might pose some challenges for the vaccine makers. Also, it might even pose challenges for giving plasma, which was from the people who were of last year and not on the recent ones. It might also pose challenges for us in getting to understand our future drug targets. So first important message is the Darwinian theory is that to survival of the fittest. So the virus has to mutate. It will continue to mutate. Double mutant, triple mutant, 4 mutants, 20 viral different particles joining. So first thing remember is that we are facing an uphill task of a virus which is smarter than their current knowledge base. Two, our biggest vaccine is self-lockdown, and self-lockdown is this: putting your mask in a very good, proper manner, covering your nose and mouth, and not exposing others or not getting exposed from others. So, self lockdown, of course, is the most important and probably the best vaccine. And the third part is not to panic. We have to understand that this virus is going to stay. Maybe there would be waves, there can be endemics off and on. And therefore, we have to learn to live with it. We as doctors, you as media person, and my very respected and dear friend, Dr. Ella, to keep on innovating to make new vaccines. With that background in mind, and having starting with a new vigor to win this mutant, the new virus, and the question that you ask now is clear. Are we in a race to vaccinate? Yes, we are in a race to vaccinate, because vaccination of the type of the good vaccines available in India will certainly mitigate the viral injury. You know, the vaccine is actually what? It's giving you a dummy run of the virus actually coming. So body is ready with its army of cells, army of antibodies. So you can prevent when the actual invader, the virus, comes. But it is not a lock and key every time that everyone has a good lock, and when they come, the virus cannot open. That lock is not so strong. So please remember that the vaccines that we have are not totally protective, 70-80%, but 20% of the people may still get infected. The urgency of vaccination is there, and I think India, in my knowledge, probably is the only country other than maybe Israel or maybe Bhutan or so, where younger people 18 and above are likely to get vaccine. So India is a country which is maybe the vaccine manufacturing hub of the world, but we have challenges, and I have some suggestions for overcoming, maybe to Dr. Ella and maybe through you to others. And one of the ways is that we should make IPR, intellectual property right, less important. We should give to multiple manufacturers. Like Dr. Ella can make maybe 60 million dosages, but maybe the country needs 600 million. We have a huge population. So allow the way we can manufacture, we have to grow together. Like in the US, there was 18 billion US dollars were given by the US government under Operation Warp. 18 billion in the beginning to 9 manufacturing companies without their asking. Like Dr. Ella is not going to, he's a very self-respecting guy. So without asking, the money was given so that people can ramp up their manufacturing capacity and innovate into new vaccines. So I think the government has come up with some money plan, but I think it's a bit late. We could have done it maybe much earlier. And if we could have ramped up our vaccine production earlier, we would have had maybe much better availability of vaccine. We could have opened this to the people at large. So people can buy the vaccine of their choice. The people can get it in the place of their choice, and maybe more effective vaccines would come. So I think in the race to win against this virus, which is very fast, we need to ramp up, we need to open up, and we also have to see that we are ready with the new variants, the variants of concern of the virus with new innovative techniques.
Right. Some very important points. In fact, I was just going to ask Dr. Ella that, but I'm glad you brought it up. So Dr. Ella, I think the big question really is about whether our 2 existing vaccines, including yours, Covaxin, are they effective against these variants? Do we know anything about that at all?
Sreenivasan, we know about the UK, we know about the Brazilian P3 strain. Yes, it cross neutralizes. South African, we don't know yet. We are working with South African country. We sent some sera to them. We are looking at those aspects of it. Coming to Indian double mutant, we don't have knowledge, but we'll have data probably in another week. So I'll give you optimism in a different way. Okay. So we are using a Wuhan strain right now as a vaccine production. Suppose if Indian government feels, regulatory feels, the double mutant might be an important vaccine candidate. I can, just like a flu vaccine, I can hop in this strain, take it out, the Wuhan out, put it back into production, and start manufacturing that strain.
Right.
It's possible. It's a regulatory, and the government has to take the decision, not as a manufacturer. If the regulatory takes a decision, so we have India double mutant is a problem, or South African mutant is a problem, and we can replace it back fast with like a flu vaccine strategy. That's a nice thing about inactivated vaccine. I can plug in quickly and ramp up, replace back the production in 1 month and get it to the field. There's a flexibility, but that government has to take a decision, not us.
That has to come from the government side.
Yes.
Okay, but what you're saying is we're still waiting on the data to be able to gauge whether the vaccine is efficacious against this Indian strain, double mutant, whatever you call it.
Double mutant, we will be having by end of this week data on this matter coming out. But I don't want to press people to come again, budge me. You said 1 week down and the data. So it takes time for us because it has to be worked in BSL-3. If any press wants to have quick data, I don't mind sending them into BSL-3 facility.
I don't know who wants to take that risk.
But we are very serious. We are very serious about it.
Right.
Want to know the data of that. If it is not working, how do we put the regulatory people into the game and change the strain quickly, put it back? So we are interested. We don't want a vaccine which doesn't work to the society. We don't want that.
So address that point also, because Dr. Sarin touched on it, that, one of the things that's happening to ordinary people is that they go out, they take the vaccine, perhaps 1 dose, perhaps even 2 doses, and they still get infected. And that makes them question the entire business of getting vaccinated. How would you sort of address that concern? Because as Dr. Sarin said, yes, some percentage will get infected. So is that something that's par for the course? But it's still important to have that protection. Dr. Ella.
Dr. Ella, please.
See, I'll put it very simple. Whether it is the Pfizer mRNA or the adenovirus vector-based vaccines or the inactivated vaccine, all of them vaccines, injectable vaccines only protect the lower lung, not the upper lung. So many people do get the disease, but it will not be lethal. They don't need to have an hospitalization. We are seeing that from Pfizer to Adeno to Johnson and to Bharat Biotech, all vaccines, you will get the protection against seriousness of the disease.
Okay.
So that is one of the drawback of the all injectable vaccines. It is not that we want 100% protection like child vaccines, but it doesn't happen. But it's people still after vaccination, they still have to wear a mask, and I think that's a must because you will have a nasal infection still. If you look at a vaccinated person, you look at the nasal, you will still have some infection, and you're still transmitting. That's why even British journals clearly said all vaccinated people still will have infection and transmission. You're not blocking the transmission yet. And only that will be blocked only with the nasal mucosal immunity. The mucosal immunity is the only one which can block the transmission, but not injectable vaccine. Okay. I think I'll leave it to Dr. Sarin.
Right. Dr. Sarin, the point about the question about whether these our vaccines are efficacious or not, as Dr. Ella was saying, that they'll have the data in a week's time, fingers crossed. But there have been some questions about whether the government, the scientific establishment as a whole, is doing the kind of rigorous testing, sequencing, I think is the technical term, to be able to understand this variant fully. Apparently, other countries have run hundreds and thousands of these sequences and tests. We're still behind on that. Is that a problem as we try to find these vaccines to respond to the changing virus?
Well, certainly, I think the government has done reasonably well by, having a consortia of 10 large labs which are doing it. And they are trying and giving us the data globally that, yes, these variants are changing. But let me put it in the other perspective. Does it help? It helps to add to our knowledge. It helps to understand the virus. But all viruses have the habit of changing and mutating. So I would say that while we are developing all these platforms, and which should increase many-fold more, we
Yeah.
also must accept that every time there will be in few days the virus will change, it will mutate, and that is why till date you don't have a vaccine for common cold. It changes every year, so every year they have to bring a new vaccine for the common cold, and you still get the cold. So the more important part today will be,
Right.
while we mutate, while we are developing vaccine, but two three things we have to remember, that people who have got even 2 dosages and also have good antibody titers still can get infected. In fact, the last data from US and from India, you might have 0.5 to 1%, even higher number of people who can get infected. So what we need to know, what is our antibody protective level? Till date, we do not have any idea what level. So vaccination and immunization are different. You get vaccine, but are you protected? That
Right.
level of antibody which is protecting you is not known. And since that is not known, everybody is prone. Please, after 2 dosages of vaccine, you still behave as if you were not. If unfortunately you get it, you will have a milder disease. The second question that you said, should we ramp up? I think we have, there was a very good study called SHOW. The show was the kind of program which was done in Wisconsin, where people followed for about 5,000-7,000 for 20 years. We have no model. You have model cities, you have model programs. Where is our model health city where everything is followed, whether it is vaccination and all that? We do not have a model of healthcare in any small town or village. Why I'm telling you this is, tomorrow, for 5 years from now, we don't have a roadmap for really handling pandemics and mutant virus, and
Right.
COVID is going to go. So we may have to have our own models of healthcare, primary, secondary, and tertiary, and to see that our people remain. We don't have a need for knee-jerk phenomena. We need to have very, very clearly prepared programs.
Right. Okay. Dr. Ella, on the related point of this question of what is causing some degree of vaccine hesitancy even now, we had Abhay Soy of Max Hospitals last week on the program. He said many of his centers are still empty, even though the virus is climbing, because people still have hesitancy. They still are believing a lot of, sometimes it's misinformation, sometimes it's old rumors that are still creating doubts in their mind. This might be a good opportunity, Dr. Ella, to address some of those concerns. I think some of it could be the carryover from the time when the vaccines were cleared by the government. This was in early January. There were some questions over whether at that time phase 3 data was still not in. The vaccines have been cleared in haste. The other is, Dr. Ella, when you get reports from other countries, for example, you're exporting to Brazil. Brazil has raised some questions on Covaxin. That also creates doubts in people's minds. So how would you address that?
I think that's a good question. So when it gets global, it gets to nationalism. And each country wants to play its own politics. Okay? And each country wants, it's not the regulatory, they want to do some strategically, okay, delay the Indian one. It's not the regulatory, but the delay some strategy. So nationalism comes in, and I don't want to tell publicly what happened in Belgium. Maybe I'll give a call to you and tell you what has happened. Brazil. Brazil, I'll call you and tell you separately. It's not good to tell in the public media. So it's a sensitive issue. But I will tell you what is that. But it's more of a nationalism of each country. They're playing that game. And each country wants to defame the other country and their vaccine strategies and all that. It's a global phenomenon. We don't have to worry about it. And we have to keep moving on. And that's one thing. About the mutation, what Dr. Sarin was telling, look at it, Sreenivasan. When you're going on a highway, there was a blockage. When you have a blockage means people are vaccinated, the virus cannot go in the highway. Now what do? The Google map says you take the diversion right side. So it has to mutate and go to diversion. And then when it's going diversion, you don't find any Sreenivasan, Jain or Krishna, it didn't find. It has to find somebody else. So it has to find a children, it has to find an animal, or it has to find a person who's not vaccinated. Okay, so it's a simple logic. It's nothing. And also RNA viruses are highly recombining. Okay, we call 10 to the power 6 log. So DNA doesn't mutate much. Whatever led to one, not even 0.00001% mutation. That is what you get. People get cancer and other things, but it doesn't mutate DNA. That's why we're still human beings. If RNA mutates 6 logs, 600 times, it can mutate, wobble. It's so much wobbling. And because of that recombination, you don't have to scared about it, but it's a part of the game of this mutation. So people, you ask me a simple question, is it we are lacking as India, as a country? I don't think so. Look at US. CDC has got all the data of Los Angeles, Las Vegas, South Africa, Brazil, everything. What is it they have done beyond that? Nothing beyond. You look at UK, they have UK variant strain, you have South African strain, all those data are there. But what did we do? Nothing. So I think, we as a country, we are always looked down. Oh, something we are not all right, we're not all right, we're not all right. I mean, that's good to have that pressure to have us on us, but that is not the truth. Scientifically, we are also looking at it and publish the papers, and that it mutates, it cross-neutralizes the strain, nothing less than that. So I will leave it there. Any other question, I'll take it.
Yes. Just one quick question, Dr. Ella, which is to do with the fact that now as the government has opened up the vaccine procurement procedure, now state governments can approach you and other private players directly. Private entities like hospitals can also approach you directly. How will you meet those challenges where there's increased pressure now from multiple domestic customers, but you are also trying to export? There's an export demand as well. How will that work?
I really don't know. I want to give my position to Sreenivasan Jain. So whether you can take over my position, I'll be very happy. That is the situations we are in right now. Since yesterday night onwards, so much of calls. So before that, we had a press calls. Now we have government calls, too many government calls. We are under pressure because we need a commitment to the government of India. And then government of India has frozen some stock. And then, so they're very intelligently blocked all the production capacities. Then now they left it to states. You figure out now your issue. So I think we are in a lockhead now. So I don't know how we are going to all pursue this, honestly. We need time to figure out the issues, how the government of India are going to help us on this matter. Because they need to help us, how we can move part of the production capacities, move to some of the states and the private marketing. But certainly I was told that even the private corporates has to take a vaccine, they still have to go to hospitals and use a COVID software through private vaccination, through Dr. Sarin under supervision. It has to happen like that. So I think they're looking at like that angle.
Okay, that's quite candid of you as always. Dr. Sarin, is this going to be a challenge that on one hand you've opened up the whole sort of vaccine availability, but is that going to, in a sense, will that help address the problem of vaccine shortfalls, or could there be challenges there as well? As you now have state governments, private entities, central, all bidding for a limited number of vaccine makers.
Yeah, it is a huge initiative, and I'm sure the policymakers have thought it carefully. What we are going to see, at least that a large population, see, India has done maybe 12-13% of its population, and many countries have gone up to 50, 60, even maybe 90%. And second dosage has been given to a large proportion. So now India has to run. It is a very, very large population. And I think these initiatives are good. But yes, the vaccination centers, the vaccine producers and healthcare workers all are likely to be under extra stress. But I think what we wanted. We have asked for it, and therefore we should be ready. Everyone shouldn't go that, oh, I waited for 2 hours and I didn't get a jab. Okay, come on tomorrow. You wait for some time, come in later hours, let the elderly and others get. So I think we need some self-discipline. We also need to understand that everything cannot be produced and be made available on day one. It's a huge initiative. I think what I fear sometimes is that, and I would like people and others to help, is that do not exaggerate your adverse event, and also do not hide your adverse event. If there is something which is coming up, all the healthcare facilities, especially right now, it is available in large hospitals. They are very well equipped. So for some time till we open, I think it will be good that you are monitored carefully, especially those who have high risk than others and they have some allergy with vaccine, possible other allergies. So kindly be careful and also give priority to those who genuinely need it first, than just because I have the right and I will go and get it and I must get it. That attitude should change to those who really need it first, and then slowly. Yes, it is open, but that doesn't mean you get crash.
Right. So be patient is an important message. Dr. Ella, just to ask you, as you said that the government has to also step up and help, as you said, in this challenging time. Now, as we know, the government has, some would say somewhat belatedly, given the go-ahead to allow some of these global vaccine manufacturers to come to India, be it Sputnik, be it Pfizer, and so on. Is that something, and they've also decided, I believe, to waive import duty on some of these vaccines. Is that something that as a domestic manufacturer, you welcome that, or do you see challenges there?
No, we welcome them. I think I want Indian citizens to have all the options available. And I'm welcome that very sincerely. But if it is well tested, well proven, yes, why not? India should have that options. I'm not denying that. But I want to say one thing, Sreenivasan, I found two observations. I mean, Dr. Sarin should also acknowledge me on this. When you have a first wave, it came, the poor people got more affected. Then you have hesitancy that time. People doesn't want to have vaccine, and people are the rich people, middle class people were hesitating. So the poor people got, in any case, naturally immunized with a vaccine, with a disease burden. And now what you see this wave right now, what is we seeing is mostly middle class and rich people.
Right.
Okay. And I've seen that my phase 3 clinical trial data, which it correlates that. Very surprisingly, Nagpur used to be the lowest incidence of zero prevalence. Nagpur, 11%.
Right.
And Bhopal was 13%. And Hyderabad, 21%. Now, that is when we are doing phase 3 trial. Now I look back, those are the areas now getting high disease burden.
Right.
And come to Bombay, although we had a Bombay 50%, is the slum area all of them got vaccinated by natural infection. So now what the people are suffering 50% are the people who are the middle and working class and rich people who are facing the problem. I think I'm seeing a different contrast of the two waves. But certainly the vaccination is the most important, and at least it will save the life of the person. You may not prevent the entire infection cycle, but at least stop the person. He can, home quarantine, stay back, you'll be all right. You don't have to crowd the hospital.
Okay. All right. I believe we have not very much time. Let me try to see if I can quickly get some questions from the audience that we have not already gone over. One was from Dr. Bharat Bhushan Singh. How do you think India will handle the global demand for vaccine when we are a billion plus? I think I'd already asked you that, about how you will export in this difficult time. Here's a question from Vidyut Chakravarti. How do states prepare themselves in terms of creating a model healthcare facility, smart card for all citizens, etc., etc.? Dr. Sarin, do you want to take that very quickly?
Yes, US had started what was earlier called as Framingham Heart Study, and they have generation after generation, elder and younger people, and they have all the data. Scandinavia has those models where healthcare has been decided based on how the people are having problems, infections, or non-communicable diseases. Right. In India, we don't have any such model. So in simple terms, we define a population of 100,000, 50,000, we follow them. And this is of different kind in how we need to upgrade. Suppose in that population, COVID occurs. Suppose COVID in children occurs in that. Pregnancy occurs. So we have actually a model where every other variable is known and just a new incident occurs. So I think we need to create such facilities where we can actually do health management policy initiatives. And I'm sure India will get there soon.
Okay. Dr. Just again, in conclusion, that now that you will have the freedom, I believe there will be greater freedom in terms of negotiating prices, because earlier with the government it was controlled. I believe covaxin is about 209 rupees a dose. That's the government negotiated price. Now that there'll be a greater freedom of negotiating prices with different entities, state governments, private entities, is that something that you think would be important for you? That were you facing pressures to produce at this price? And also, what would be a more realistic market price in your view?
Realistic price, as a company, we would like to have the maximum possible. So we want to recover as much as possible all the clinical trial costs and all other costs, and then put it back for R&D. It is not to, I never gave a dividend in my company. I'm still living simple living. So I want to keep the money for any future pandemic vaccines. We are working on chikungunya, Zika, NTS, and H1N1 new flu vaccine problem. All that we are working, we need a cash. There's no question about that. It's not that we don't want a cash. We want cash for future R&D. But we are going to have a complex situation. How is the central government pricing? How is the state government pricing? How is the private market pricing? It's going to be complicated issues for us right now. So rabies vaccine, we used to sell to the state government. Each state government is a different pricing based on the volume, logistics, cost, all that we take into consideration, and what time the delivery they wanted. All that we take into consideration. Rabies, we have knowledge of working with the state government. But certainly the private market, we work with children, and working with adults is the most dangerous. Children are easy. You give a vaccine, the baby cries, you just show a toy, the baby will keep quiet. Adults are dangerous people to get vaccinated. So they are worse people to get vaccinated. So I think we're going to face a lot of problems with the adults vaccination, and it's going to be challenging for as a country, as a manufacturer.
And no, on the pricing, you're saying it's going to be complicated to try to negotiate with all these different entities, is it? On how do you arrive at a price?
I don't, usually the rabies vaccine, the state government might have to call for tender only. There's no choice. Because, they will have accounting process, whether it is how you would decide the pricing. So that problem is going to come in. So state government will call for a tender, and then they select the parties, how they're going to do it. They have to find a mechanism, because they cannot be just without tender. They may not have to go without just buying from somebody.
Right.
So that will be a process will be difficult.
And the private end, like the private hospitals, etc., they'll also be approaching you now under these new guidelines. So they'll be negotiating.
We need to work with the private hospitals, and some of the corporates, we are also talking to us. Maybe corporates can go through the hospital. So we need to have tripartite relationship: a manufacturer, a corporate hospital, and the corporate. All three of us together, vaccinating their employees and their children and all that.
Okay, we are very short on time. I'm told just 2 minutes left. Let's just get quick last comments from both of you. Dr. Sarin, any last word if you'd like to think that when it comes to vaccine policy, is there one thing you believe that could be done either by the government or by vaccine manufacturers? Wish list.
Well, I will take the group, Sreenivasan, and this AIMA has 38,000 members. I would like each of the corporate members to do 1+1. You get one vaccine for you, give plus at least one free vaccine to other. Let this be your social responsibility for at least next 1 or 2 years. Be a good Samaritan. Second, donate 1% of your at least revenue for research and development. So give free vaccines, as many as you buy, give same number for poor or other people. Put at least 1% of your revenue, not profit, not CSR, for research and development in health. Invest in health so your country's health improves.
Wonderful suggestion. I mean, really, I applaud that. Dr. Ella, if you had one wish list as a vaccine maker, either from the government or from other stakeholders in this high pressure time, what would that be?
I want the people to believe that Indian science is not behind any of the Western countries. We have a different perspective that Indian companies are all lower standard. I don't think we are lower standard. And please look at it. Because we are fighting with the US and Europe on the technological angle. So please, we are not looking at between Indian companies. We are not fighting. We are fighting with the global companies. So that means we are science and technology. We are on par with any of the world. Please believe that have the hesitancy removed from your mind, and please vaccinate. It's not that I'm talking as a commercial company, but even if it doesn't protect you 100%, you are protected at least severe disease.
Right.
I think you protect yourself, protect the family. Thank you.
Okay, wonderful. Two very important messages from our panelists right at the very end. Be a good Samaritan, says Dr. Sarin. And as Dr. Ella says, vaccinate, protect yourself, protect your family, believe in Indian science. Thank you, gentlemen, so much for joining us. It's been a fantastic conversation. And thank you all so much for watching. AIMA, once again, thank you for organizing this. Thanks very much.